Hello, everyone. Welcome back to the BioNexus Health podcast. Today, after a lot of you requesting me to revisit with our New Yorker Tariq about his mold biotoxin illness, his sinus issues, the tremendous sinus problems that he has had for many, many years. And the questions have mostly been to ask how he's doing today, if his benefits have maintained themselves, any changes. So I emailed, we emailed Tariq and requested another podcast, and very generously, Tariq has agreed to that, and he's here today. So in about 10 seconds, we will be welcoming Tariq to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
Good morning, everyone. I'm very happy to be here and very happy to be back on another podcast. And very thrilled to share my journey, my story with everyone, so they get a clearer idea exactly of how things went and what to expect and the particular ups and downs that I've had and where I am today, which is thankfully in a lot better place.
Awesome. Well, good to have you back. And so, if we could have succinctly, of course, let's talk about, Tariq symptoms, life pretty much before the BioNexus herbal protocol, and Tariq today or after being on the BioNexus herbal protocol. Pretty much, it is to emphasize that in a completely natural plant-based manner, you've achieved what you've achieved with your health.
Yes, and it's important to say that I was very receptive to any solution. I wasn't just looking for either natural, unnatural. Just like anybody with a problem, you just want to have that problem solved. So obviously I prefer the natural route because I don't want side effects. I don't want any other issues, but I'll go to a physician. I'll say, listen, here's what my problem is. You are an expert, you fix this. So this journey started when I noticed problems initially in 2016, as far as back as 2016, and I noticed that I had some sinus issues. So I went to who I knew in the area is the best sinus doctor there is. They made some tests and they pointed out some allergies, and they sent me home with some over-the-counter medication. I tried that and nothing really worked. I kind of took a step back for a while, and then a year later was really starting to bother me that there was nothing out there that was really working. So I really did some more research, and another doctor a little bit further upstate, and I had to travel a little bit, went there. He made some tests, and he said, it looks like you have something, you've absorbed something, and if you have lost your sense of smell for over a year now, there's really very little we could do for you. And which is exactly what I was going through. I noticed that my sense of smell was very, very, very low. Didn't quite understand what was going on. We tried a couple of remedies over the counter, nothing serious. They did work very, very temporarily, but they didn't last. And then, my symptoms started to get more complicated after that. I started feeling more fatigue. I started feeling, less of a zest in life to do things, less interest to do things. I could feel some hormonal changes, not on the positive side. And I started to realize that there was something more going on that I didn't understand. And yes, I was getting treatment. I found out later that there was there could potentially be something with a candida issue in my gut. Not your typical candida issue that you find in your skin or your toenails, not that, something in the gut. So I attributed that to stress that I was going through, at that time in my life, and I started getting treatment for that. And feeling a little bit better, but no remedy for the sinuses. It just kept getting progressively worse. So bad that I lost pretty much all my mucus. I was feeling tired. I was feeling very, very fatigued and feeling very unhappy generally. and not very active. So I was talking to a doctor at the time. I'm not going to mention any names. He's a very, very good doctor, by the way. I'll just call him Dr. B. And Dr. B was um, very skilled in candida remedies. And I really thought at the time that that was my issue. And if I resolved that, everything would take care of itself. And to a certain extent, that was true. And it was a long process because candida is a very tricky um, type of organism to handle. It's got antibiotic resistance, so you can't just take a pill and feel better. And although he did a marvelous job in handling the candida issue, and that was tested and resolved, it still didn't take care of my problem. And I remember one of the last tests I did with him was a nasal test, was a nasal swab test. And when the results of that came back, I had a staph coagulative staph positive test come back, which means that I had some antibiotic resistance inside my nasal cavities.
Oh, wait. So your coagulase negative staph came back positive, which means you tested positive for MARCoNS.
Correct.
Okay.
And I didn't really understand what that was initially, right? So he said, well, you can try certain remedies, this and that. At that point, when I saw that signal, I really wanted to do a little bit more of my research and find out what this was about, because that sinus issue was at the forefront of my pain and my discomfort. And I really wanted to get to the bottom of this. And this has been years now that this has been happening with no end in sight. So I started researching the tests and the meaning of those results and everything, and I came across BioNexus, and immediately at that point, my intuition told me that that's the direction I should be going through. So I wasn't really referred to you like most of your patients are. I had to kind of do my own research, but I had to kind of figure that out on my own. So I called your office, set up an appointment, and that's how my journey started. And I saw the Formula One NSP that you had created. I listened to some of your videos on that. It was very interesting. And as soon as I got on the protocol, I started using that, and amazing results, absolutely amazing results.
With overall, okay, so you've been on the protocol. You discussed your protocol journey in your original podcast. So now where you're at today, what improvements? So we heard about Tariq before, right?
Yep.
And sinus issues, some candida issues resolved, fatigue, a few other symptoms creeping in right there. And then you started the BioNexus protocol. You've shared some improvements with us in your last podcast. And today, where are you at? How have those improvements continued?
Yes,
right?
yes, absolutely continued. And one of the biggest, and I was just noticing that one of the biggest benefits that I take for granted right now is sleep. A comfortable long night's sleep, which I've struggled with for many, many years. I would get up in the middle of the night many, many times, very uncomfortable. And I tried everything. I mean, you name it, I tried it. I mean, I would have to even take Tylenol PM sometimes and force myself to sleep that way. I would take like various other natural remedies. I even called that annoying My Pillow guy that comes on TV every 5 minutes telling him about his pillows. That didn't
seriously?
work.
Oh my God.
Yeah. So none of that worked. So now, now I'm getting a much better night's sleep. Now my sense of smell has restored to a point where I can identify smells that I couldn't identify for like 7-8 years, So that was to me, that's miraculous. My breathing is so much easier. My breathing is so much more comfortable, but my hormones are so much where they are supposed to be. My testosterone level was very low, and it's back to normal right now. My physical activity is night and day. I mean, I'm able to do things physically today that I was just feeling weak and tired all the time and disinterested, and that was my normal state for years. And it was very difficult to explain to, my family, my, people that surrounding me, that I wasn't feeling up to certain activities. And I wouldn't enjoy vacations. I would just, hang out. I wouldn't really do much. Now it's totally different. My activity level is back. And my breathing is far more comfortable. My sinuses feel much better, night and day from where they were. I know I mentioned you have sleep apnea, so that's improved a lot since then as well. So yeah, here I am today. I mean, and I could tell you that, something, in the middle of my treatment, I actually realized something about this medicine. There's a lot more to it than meets the eye. It's like, I'm asking myself, how could it be that I go from physician to physician, and these are experts in their field, and there's very little that they could do. There's very little that can be done. And here I am, I show up, and you have these remedies that predictably work, and you said they were going to work. There wasn't like, let's try this, because, with the other physicians, like, we're going to try this. It's like, I don't want you to try anything. I want you to get me somewhere where I need to be. It's like, you were very confidently saying, this is how long it's going to take you. This is going to be gradual. This is, it's going to be, and you're going to be okay, And I'm like, great. So that to me was very remarkable, that your level of confidence in that you're going to achieve the result that I wanted to achieve. So I'm thinking to myself, how does this, how did that happen? How did I get there? And how does this work? How is it different than a lot of the other work that I've come across? And for me, the best way that I can describe it is if you make a comparison, so to speak, in history. Let's just go back. I know I don't want to go off tangent, but I really want to say this. So viewers really understand how this protocol really works. If you go back in history and you make a comparison in history, because when I found out is that not only the sinus is just the tip of the iceberg, right? As I read more about this, the real culprit here were the myotoxins. The real culprit here were this toxicity in the environment. And it manifests itself in a lot of different ways. It manifests itself in sinus tissues, in brain fog. It causes a lot of inflammation, which over time can lead to neurological issues in the brain. And some of these illnesses that we look at today and are unexplained as to where they came from and how do you fix them, all come from toxins in the air. I mean, a lot of them, they stem from toxins in the air. And this isn't something that even the best doctors are ready to admit or understand, that the toxins in the air cause a lot of these issues that we have today that are broad medical problems that are unexplained. And if you go back to history, and if you compare that to, let's go back, imagine for a moment we're in the 19th century, and what are the illnesses that were prevalent back then? You had anthrax, you had people dying in hospitals, you had childbirth issues, you had a lot of different problems that they couldn't explain. And then you had this one chemist in the 19th century by the name of Louis Pasteur. And he comes up and says, I found the culprit, and I found out what it is. It is microbes, it is germs. And here are germs before they enter your body. Here's how they change their condition after they change your body. And they're responsible for all these diseases, and they're responsible for all the unexplained deaths that we see today, or unexplained illness that we see today. And he was able to come up with a remedy to eradicate all this. And he prevailed. And at the time that he wasn't really regarded as very credible. But when you look at some of the similarities today, we have this science is coming up and saying we have identified the culprit. The culprit is myotoxins in the air. The culprit is mold. The culprit is like air pollution, and they may directly or indirectly cause the harm and the illness in your body. And we have the remedies, and we have the protocols, and we have the understanding on how to reverse this and make you better. And this explains why when you see someone like you who has the knowledge to eradicate antibiotic-resistant bacteria, that's why when it's antibiotic resistance, that's why it makes sense now why the drug industry can't help you, because their remedies are not suited for antibiotic resistant types of illnesses. So that problem's on the rise, by the way. I mean, you hear about it all the time. You hear about celebrities getting sick with antibiotic resistant illnesses. You hear about it's starting to get a little bit out of control in some hospitals. And unless somebody comes up and says, listen, we have something, we can fix this, and it does work, then you're really pretty much wasting your time going to these doctors and trying to get, the conventional medicine to help you reverse an antibiotic resistant, invader in your system. And they don't really understand, even when they do know what your diagnosis is, they're not really equipped to reverse it, let alone understand the broad scope of it. And what really kind of put two and two together were your protocols also on hygiene, and how to make sure that your surroundings are safe, how to make sure you've gotten so much detail as to how to put a formula together to put a cleanser that cleans the surfaces of your furniture, and take care of your surroundings so you're not always exposed to these elements. And it's the same thing when you look back, back in the 19th century, they didn't have any protocols for cleanliness. When they had, surgery was done without washing your hands. Their instruments weren't sterilized. They didn't really understand that germs and cleanliness were the real culprit that are causing all these illnesses that are unexplained. And then that had to change for them to see some sustainable results. So that's my whole picture on this. It's far more important than just to limit it to one area that you can achieve a win in. It's like a very broad spectrum of life improvement, that if you understand it, if you understand how this works, then you are not susceptible to getting in trouble again with this.
Very well said. Yes. One point that comes to mind is microbial intelligence. So someone like yourself, who's been to many different specialists with minimal to moderate benefits, but seeing benefits, which keeps you going. It is important to keep in mind that once you discover something as powerful as MARCoNS, right? That is what you mentioned, the coagulase negative staph, that is multiple antibiotic resistant, not just one, multiple antibiotic resistance. MRSA is only resistant to methicillin, and MRSA is the bane of many medical practices, hospitals, right? The infections, it can manifest on skin lesions, it can manifest elsewhere in the body as well. So MRSA is coag positive staph, and it's methicillin resistant staph aureus. MARCoNS is staph supercharged. It is coag negative staph, meaning it can make biofilm, hide from the immune system, and it develops multiple antibiotic resistance, secretes two toxins that cross over the blood-brain barrier and causing a lot of inflammation and damage up in the brain. And, you mentioned hormonal issues, you mentioned mood. So mood, brain fog, hormonal issues, visual issues, all of these can be attributed, including generalized inflammation in the body. Gut, sleep, natural bodies, regular, the body's biological rhythm regulation as well. So all of these can come from strong antibiotic resistant bacteria.
Yep.
Yeah, so this is one thing that's important to understand is I mentioned microbial intelligence earlier. So that means, many bacteria are quorum sensing, many, all of them exhibit the bacterial intelligence, some more than the other. Strep, staph are very smart bacteria. Lyme disease is very smart, as is Bartonella. These know how to evade, especially Lyme, strep, staph, they know how to evade the immune system, produce biofilm, attack the host, keep feeding off of the host so they can reproduce and grow and thrive. We are the host, of course. Many studies have been done which show that bacteria speak to each other. So the antibiotic resistance can be transferred. You have someone who has been treated for MARCoNS. Okay, I'm done. MARCoNS showed up negative. Sure. And then a few months down the road, the same person ends up getting, your regular staph infection. You're given, routine staph treatment, amoxicillin, for a couple of weeks. And then, nothing really changes. In fact, you start to develop additional symptoms. If this happens in a child, they start to develop symptoms of PANS because it's strep. And you have many practitioners scratching their head, like, what is going on? Or worse, not even aware, and doing one round of antibiotics after another, not looking at antibiotic resistance. That strep could have easily acquired the antibiotic resistance from the MARCoNS that used to exist.
Wow, I didn't even realize it was that sophisticated, but yeah, it is. It's hard to understand when you're not in the field, but now that you make it clearer, it makes so much more sense. Because at the time you're thinking, I have this problem, let me just get rid of that, I'll be fine, and you don't really understand that. And this explains why people go from illness to illness to illness, not understanding why they just can't get rid of an illness, and it just manifests in different areas of their system. But the whole idea of antibiotic-resistant bacteria is, I think, the issue of the day, the medical issue of the day that the medical community should be concerned with, and not just quick fix drugs to enrich themselves. I mean, it really takes a dedicated team of physicians that stick to their core values of making patients better to figure out exactly how everything works and how to remedy it. When you go to your physicians today, I mean, you're pretty much treated as patient A, patient B. Yes, they have care, but they're very limited to the scope of what they can do to treat you, because nobody's doing the thinking outside the box and saying, how is this problem going to get solved? Without just giving a person a drug and just hoping for the best. And
Yes.
I mean, yeah.
Yes.
Yes.
So that is the lack of awareness, Tariq. It's not anybody's fault. It's just that, research has been around, like mycotoxins. Research has been around for more than 20 years. It's not recent. And, Lyme research has been around for more than 30 years. And it's still the awareness, the controversy, the ego problems, unfortunately, most of us patients, and I was the mother of a severely ill child trying to save his life. We have to end up, just like you did, looking for options on our own, researching on our own to see what is available out there that you haven't yet addressed. So yes, if you're having one problem, like with you in your case, it was sinuses, and you've tried everything, you've been to the best doctors, you've kept an open mind, and you're not thriving, the issue is not going away. Your sense of smell, your zest for life, like you mentioned, isn't really budging a whole lot. Your needle is not moving towards enjoying life and being positive. Then you need to look for something else. There has to be an answer. And yes, microbial intelligence is a real thing. It's not, microbes passing information from one cell line to the other. Not just same species, but between species, information gets passed on, especially antibiotic resistant, So yeah, not too many, it is not common practice that before treating for strep, someone does an antibiotic resistance because, it's expensive. It is not routine. Takes time. It takes more than one visit. The patient wants to feel better now, or at least thinks he is going to feel better because, medication has been prescribed. So by the time the patient realizes they're not feeling well, it's already been 10 days. And sometimes the patient doesn't even realize that, strep goes to the heart, it goes to the gut, and these are all documented. Some patients I've heard from, develop what's termed as eczema and eventually diagnosed as impetigo, and strep is the culprit. Happens in children because the kind of patients I deal with are children with PANS, PANDAS issues. Happens in adults. So
Yeah.
that's where we are at. But okay.
Yeah, I remember reading the biotoxin pathway was
Yes.
first when I decided that this was really the right course, because that outlines step by step pretty much how the illness progresses. And I think he had 7 steps to the biotoxin pathway. Is that
12
right?
steps to the treatment, yes.
Yeah, no, the actual of how you feel, like initially when it starts to get in your body, this is how you feel, and then you get the next
6
step.
steps, correct.
6 steps, yeah,
Yes.
yeah, six
6
steps.
stages, yeah.
6 stages,
6 stages of the biotoxin pathway.
Yeah, I felt I was like in stage 8 or 9, I felt I was like really way down there, so I was like, wow, this is like my symptoms and more, but it was,
you had a stage of your own.
I had my own stage.
8
Yeah, it
or
wasn't
9,
researched. Yeah, it wasn't known to
yeah.
medical scientists yet. But yeah, it's pretty bad. It was just getting myself to do anything was extremely exhausting. And I didn't know whether it was stress or what it was. It was very, very confused. But as soon as I read that, I could identify with it, and I said, well, here's a science that actually understands what's going on with a person, because that's what I've been trying to explain. And everybody's saying, well, we'll try this for that, we'll try that, whatever. But again, it's important to know that it's not only has the culprit been identified, which is a problem that I've had with many of the other physicians that I've met, is they couldn't identify the culprits. Like, I had physicians that knew that I had toxins within my body. That's not a secret. That's easy to diagnose. But where it came from, what it's doing, how it's going around causing havoc to the system, is something that they did not understand at all. And they couldn't, and by them not understanding that, they couldn't really, piece it together and figure out how to ease it off. And it was just, well, you're going to take those binders and they're going to bind, and they're going to, come out of your body and this and that. And I actually took these toxin, a lot of them, before I actually started getting treated by you. And that didn't help. So it's not just a matter of, well, you have toxins and, we're just going to take them out and you're going to be okay, because there was a lot more going on inside me that you could identify that these other physicians could not. And you had a step-by-step system into how exactly that's going to move out and get eradicated. It's remarkable. I mean, the difference is night and day. I mean, I can do things now, a lot more active now than I ever was at any point. I feel more relaxed. I feel I can actually enjoy things. And I'm not stressed out. I'm not, as moody as I was before. A huge difference in sleep. I mean, that's one of my biggest winners, by the way, is because when you lack sleep, you lack a lot of enjoyment. You're not able to function your day. You start your day a little edgy, and then you're just like, you can't relax. You can't take an afternoon nap even if you have the time. So that's been a huge blessing for me. So yeah, again, I can't stress it enough. I mean, this is a remarkable discovery. I mean, a big triumph for humanity that we have a science that actually solves a problem that is very prevalent, that people don't understand. That the last time we've seen something like this was way back in history, where there was a huge revelation in discovery of what is a culprit. Now that we've identified the culprit, we know how it moves in the body. We can eradicate it, and we have to get a lot smarter about how we live and how we sanitize our space, so we don't have, I mean, back then it was like, before the discovery that the germ was actually harmful. I mean, you had trash everywhere. People were not very hygienic. Medical procedures had no hygiene protocols in them. And Today, when you look at a water damaged building, people are like, well, that sucks. Sucks when that happens, but what are you going to do? We'll get around to it later. They don't understand that, the mold exposure, the toxin exposure is a very insidious invader on the body. Same thing with the household cleaning supplies. For some people, they have susceptibility to that. Air pollution. So the toxins, the mycotoxins, is a subject that has to be taken seriously in today's day and age if we're going to solve a lot of these problems and not find ourselves going back to, trying to chase illnesses that we can control and are getting smarter and more resistant than what we have here to handle them.
Yes, we can't have the microbes getting stronger and humans getting weaker because of lack of awareness and no strategies. Yeah, that's one of the reasons why it was important for me to develop. You mentioned, you tried toxin binders.
Yeah.
That hoping to feel better from the mold toxins. I'm assuming you meant conventional binders for removing mycotoxins were tried. Yes, those are the kind of patients I see in my practice. So the goal has always been to keep it completely plant-based, keep it all natural and mild, step by step. And, because patients are already compromised health-wise, and adding in aggressive protocols, I haven't seen good results. So the goal was always to keep it manageable and tolerable for clients to go through the entire herbal protocol. And here you are, brain fog, inflammation, gut issues, sleep issues resolved, energy, endurance.
Testosterone level is back where it was before. Yeah, that's was
a huge plus.
Oh, huge.
Yes.
It even from what it was a year ago, major difference.
Now let's stress this, Tariq, that you haven't done any testosterone gels or creams or injections or anything of that sort, because that is actually first of all cumbersome, no guarantees, but that is contraindicated when you are treating for biotoxin illness, because that contributes and adds to the inflammatory pathway. So you've achieved this, on a completely plant-based protocol without any invasive treatments at all for your testosterone levels. It's come up. That's your,
and it's come up without me doing anything, at all specifically for that problem. So I wasn't really looking to solve it. I had other headaches. I said, okay, I'll get to that testosterone problem later. Even though it'd be nice to take care of it now, but I got bigger fish to fry, So I really, it was suddenly, I just found myself back where I was, and everything sort of like took care of itself once you understand what the source of the issue is and how to fix it. So again, to me, it was about the bigger picture, that I could see the bigger picture of what was happening here, and I could really respect this whole process as a way that understands the culprit, understands its movement and what it does and how it wreaks havoc and what we're doing. Because unless this is understood, there's going to be times when somebody going through this is going to maybe think of giving up, or maybe thinking that this is just another, a failed attempt of handling my problem, or I just don't want to go through it anymore. And it's important that you understand that. It's important that you actually get exactly how everything works, because that will only raise your commitment level to making sure that you come out of it the other side successfully, rather than just you wake up one morning and you do have those days where you're just very frustrated that, you're just not feeling where you wanted to feel that day. It's just like, I've been doing everything I'm supposed to do, but why am I not there yet? You have to be patient. You have to understand that this is a process, stick to it, stay in communication with you. And then this has to be fixed. There are no other options. If you don't do that, the collateral damage is a lot worse. You'll find yourself in a place where you can never get out, or it's impossible for you to improve without some very drastic procedures. So I'm very thankful that one of the first things that you did recommend to me is to be patient with the process. And you said, you look like you're not the most patient guy in the world. And I'm like, you read me right, because that was me. I want to feel good yesterday, and when am I going to feel good next week? I'll wait a week if I have to. But once I understood everything that you had, and once I read about it, and once it made sense. And the best strategy is not to look for quick results, because if you went after that, your body wouldn't be able to take the stress level that it takes to detoxify yourself very quickly, and you might have your organs, might be damaged in the process, So it's good to ease it off in stages and just, let it take its course, and you'll gradually start to feel improvement. And then one day you'll just get up and you'll feel, wow, I've never felt that good in many, many years. And you'll be very thankful.
That will stay with you. You'll be thankful, and that will stay with you. That's what I found myself and with my son as well. Yes. So we're not looking for a magic bullet, a quick fix. We are looking for something that rebuilds you from within. And, the kind of improvements that we've seen in people in our age group, Tariq, right? Usually it's just swept under the rug. Oh, you're getting, up there in age. Oh, you're already 40 something. Oh, you're, this is part of life, aches and pains and sleep issues and, hormonal issues. Oh, it happens. It's only downhill from here. And people actually expect that and believe that. And for people, in the 40 plus age group, to see such tremendous improvements on a completely plant-based, non-toxic protocol, that is something that should be very encouraging for everyone listening and for us as well. I'm looking forward to having moving into 50s, 60s, 70s, 80s, 90s with no prescription meds.
Yeah. No, it's definitely a plus. A lot of people I know are into supplements, and they think, well, I'm not going to do the drug route, but I'll stick to these supplements, and the supplements will fix. And that was myself, because I thought, I'll see someone that just prescribes supplements and they did work and they do make me feel better, but that's still not good enough. You have to understand that that person giving you supplements is not well trained in the kind of issue that you have. And I went through that. I had a chiropractor who was trained in supplements and did a remarkable job for me and a lot of other issues that I had, and I felt much better. But he was not aware of anything to do with toxicity, mold exposure. He's not aware of that, and that's why I keep going back to understanding what the culprit is, because a lot of these physicians don't know what the culprit is.
Right.
And
I agree.
and once you identify the culprit, and once you identify that how insidious it can get within your body and what it can do, this is the direction you need to go in. Because if you don't, you're going to have a lot of A+ physicians that really can't help you, even though they have good remedies, they have a good understanding of how things work, but they don't have any training as far as mold toxicity, mycotoxins, and how they and how the biotoxin pathway works. They don't have any understanding about that. So between that and between the pharmaceutical industry, where you're dealing with antibiotic-resistant bacteria, you really don't stand a chance unless you go in the right direction. So that's important to know, is that there are no other options that I know of that understand this protocol and understand exactly what's going on and can measure it scientifically. So, you do take blood tests and you do measure a lot of these types of tests in the body that a lot of other physicians don't prescribe. And you do start to see changes. My C4A test has improved by over 90%. That's a toxicity level. It's improved by over 90% within a year, So that's how you measure your progress as well. So, yeah, so it's drugs and supplements. Even if it's natural based, it's still, the natural based supplements are still not going to do the job.
Supplements,
yeah.
yes, exactly. See, I would like to say something here about supplements. Fantastic, right? Vitamins, etc. These are supplements. Now, these are excellent band-aids and crutches for the body when that support is needed. But let's not forget that the body is designed to self-sustain and to absorb whatever minerals, vitamins, etc., that we need for our day-to-day activities and survival and health and wellness and thriving. Body is fully capable of that. So the goal shouldn't be long-term, hey, I'm going to be doing, you mentioned testosterone, hormonal, thyroid, estrogen. I'm going to be doing this for the rest of my life and it's fine. I'm going to be doing vitamins no, you need to bring, that's not real health. Health is where your body, health and wellness is where your body is capable of self-sustenance based on your diet, what you're putting in, based on how healthy you've made your body from the temporary support with supplements that you provided. Now, the difference between herbals is they are actually medicinal. So detoxification and elimination of causative factors is very important, and that needs to be done in such a way that those are either put in complete remission or they are completely eradicated depending on the species that we are handling. So herbals, while classified as supplements, it's important to remember that they are medicinal, not just band-aids.
Yeah.
So that is the difference. And yes, for those who are seeking a completely natural approach without conventional medication, because of sensitivities, intolerance, there are many reasons why people choose to be completely naturopathic, belief system as well. Then it's important to find the practitioner who is aware and is able to use herbals medicinally as required. The strength, the dosage needs to be customized. And yes, of course, like you mentioned, your C4A, TGF-beta, MMP9, those have been monitored. We respect Dr. Shoemaker's work. He knows he's awesome. He's been, his work has been life-changing for so many. But it's excellent that there are practitioners that offer options based on the same core science, the same core scientific principles established.
Yep. And these are the only ones that work with with what we're facing right now. I mean, what we're facing right now is something that is drug resistant. So
drug resistance?
Yeah,
yes, exactly.
Yeah.
Yes.
So drug resistance is a very serious problem. It really is. I don't think people understand how insidious it is, because it reshuffles its genetics around every time something even natural comes in and invades it. So if you have like a natural remedy, a natural supplement that somebody says, well, that'll take care of that particular problem, it will temporarily until that germ or bacteria reshuffles its genetics around to where it's now in a new state with new antibiotic resistance membrane around it that prevents it from being attacked. And then you have the same problem all over again, which explains why a lot of people feel better and then relapse and feel better and then relapse and feel, it just keeps going.
But that doesn't happen with herbals.
Yes.
When herbals are used at medicinal concentrations, obviously safe for consumption, because we are, if you're consuming herbals orally and then using the same herbals in your nasal passages, obviously it's completely non-toxic. But at medicinal strength and concentration, that is when you will see that there is, each herb has so many different active phyto elements and bioactive phyto compounds in it that it is nearly impossible to develop any kind of resistance to herbal medicine.
Yeah, and that's the That's the major win, I think, here is that it's not going to be reshuffled around. Whether let's say if you don't take it for a day or so and come back, it's not going to like be that's advantageous. You didn't skip one maybe or whatever. That's not going to hurt you. But at the end of the day, it's the only thing that I found that really works. And I'm talking about like a journey that's taken me many, many years to get here. So extremely grateful. I've definitely come out of this better in a lot of different ways now that I understand, inflammation, now that I understand, all the collateral damage that this can cause, not just directly, but indirectly, because if you don't handle it and you have this consistent inflammation going on in your body, in your brain, long term, the effects could be devastating. It takes time, but you can get yourself involved in neurological issues and a lot of other issues later in age and life. So it's important to take an active step now and prevent that while you still have a chance, rather than just wait it out and just handle it on a symptom by symptom basis. So you have to understand that this whole thing has to be handled. The inflammation has to be handled. A lot of other parts of the protocol take care of these problems.
The root causes.
Automatically. The root causes automatically. Mm-hmm. So you're left with a much healthier self than you were.
I couldn't agree more. Thank you. You speak very well, so thank you for your insights.
Thank you.
I appreciate you being here today and engaging in this very lively and informative discussion.
It's good to be here and amongst people who understand exactly, what the problem is, and it's sometimes difficult to express to family members because they don't understand. So it's good to be able to share it here with others. I appreciate that.
Well, that brings us to the conclusion of today's podcast. Thank you for joining me. Until next time, be well, and I will see you soon, I hope. Take care. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.